Tale of Two Hygienists presents this week's TIPisode. Quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode. This week brought to you by GC America.
Hello, my name is Amber Auger. I'm a practicing dental hygienist, international speaker, and creator of Thrive in the App. And today I have the privilege of bringing you a TIPisode from my friends over at GC America. And what we're going to discuss today is really how to convert that patient who is maybe a long-term prophy patient who needs scaling and root planing has never had it. There's so much fear wrapped up in that conversation. Fear from how we handle ourselves, but also the patient fear. So let's start from the top. Oftentimes what I find is as dental hygienists, we are fearful of educating the patient on this new change. Perhaps maybe they have never experienced periodontal disease before. Maybe they were healthy 6 months ago, and now they're in your chair and they are showing evidence of disease. How do we handle that? And what does it mean for our clinical skills if that patient that we've been treating was once healthy and now diseased? What we have to remember, number one, is there's so many different factors to periodontal disease, including systemic changes, changes in cortisol levels of stress, oxidative stress as a whole, that patient's nutrition, and of course, their home care. We also have to look at what pathogens are currently in the mouth, and all of these play a vital role. But the key to your patient's success, whether it's with soft tissue or hard tissue, diseases and management and creating that health, is of course having them take ownership of their role in their oral health. So if you've been treating a patient and they now, even if it's for years, and they now are showing evidence of disease, we need to educate at that level and ensure that we are not blaming ourselves for that disease. Now, this may sound really simple, but through my years of speaking and consulting, I experienced this a lot. Or you've done scaling and root planing, and the patient comes back in, and you're seeing evidence of disease again. What do? Specifically those patients who've had scaling within the last 2 years. Maybe the first 2 times they've come back on that 3-month maintenance, they were healthy, and now they're showing up again and it's diseased. This is where we really need to be thinking comprehensively. What is the pH of their mouth? If they have an acidic pH, those periodontal pathogens are going to thrive much easier. Clinical science shows those pathogens are going to be more mobile. So what are we doing to identify those pathogens? Perhaps it's using a microscope, or perhaps it is using some sort of salivary diagnostic technology. And this could look as simple as having that patient provide a saliva sample, sending it out to the lab before they even enter into your practice. This way, once they come in, you can review those results and you can determine the level of success. For me personally, I think it is time to really revolutionize how we are treating our patients, specifically non-surgically. And if we're not identifying the pathogens that are present in the disease state, or even before the disease happens, are we really doing a great service for our patients? In my personal opinion, it's no, because we now have the evidence of periodontal pathogens going through other areas of the body. For instance, P. gingivalis and those antigens that P. gingivalis carries are being found in Alzheimer's patients. For me personally, as a preventative oral health specialist, I want to be able to identify that at its earliest stages. Even if that patient doesn't have inflammation currently, I want to be able to identify it and then work to eliminate it. So it is essential that we think differently and we add multiple solutions into our periodontal protocol to meet the ever-demanding needs of that patient and to prevent the progression of periodontal disease from its earliest stages. Now, we talked about having that patient take ownership, and I know that many of you are familiar with the GC America Tri Plaque Gel. Now, this gel, for me, has really revolutionized the way that I educate my patient. Why? Because the first thing that a patient says with typical disclosing solution is, well, I didn't have time to brush, but this is time stamping it. And it's showing the patient, actually, no, this is mature plaque. In addition to that, any areas that are stained in blue are going to alert me that the pH of the mouth is acidic. So this is where I'm going to loop in the conversation about products that will help neutralize that pH and ensure that we're having conversations around what that patient is eating or drinking and how their diet can promote inflammation in the mouth and acidity in the mouth, which of course goes back to creating an environment where periodontal pathogens love to thrive. And let's face it, we want to eliminate any risk factor that is going to increase that patient's risk of periodontal disease. Educating this way really puts that patient back into the driver's seat. So instead of simply shaming the patient for what they haven't done, we now turn this conversation into more of a powerful one where they feel that they have control over their level of disease. So for example, if I'm working with a patient that has xerostomia and has 5-6 millimeter pockets, is on multiple medications, I say to the patient, due to your specific risk that you have the dry mouth, this actually creates an environment that's harder to stabilize the bacteria. Because you're lacking that saliva, the saliva cannot naturally cleanse out bacteria as others could. This means that we need to work harder to effectively remove the bacteria. This is why I'm going to recommend a water flosser. And the reason for that is because your pocket depths are deeper than a traditional floss would be able to reach. What I'm recommending today to prevent the progression of this disease is non-surgical periodontal therapy. Now, don't let that scare you, and I don't want you to go and Google it, because what you're going to see most likely is flap surgery, surgical periodontal maintenance. And my goal is to partner with you to reduce your risk of ever needing that. What I'm going to need from you is a commitment that we are going to work together to effectively remove the bacteria. So let's talk about these products and see if these two things that you could start implementing today would fit in your everyday routine. How does that sound? That is the exact script that I'm giving the patient. Oftentimes the patient's going to come back and say, will my insurance cover this, right? And the next thing that you need to say and follow up with that is this. During our appointment time today, I've gone ahead, I've collected updated films, and I've collected a comprehensive periodontal charting, which provides the insurance what they need to confirm our diagnosis that we've made here today. So we are going to submit this to insurance. We're going to get a pre-treatment estimate for you so that there's no surprises on your financial commitment to the practice or your financial responsibility. And we are going to collaborate to maximize what the insurance will cover. Because you have this level of disease, we can no longer see you once every 6 months. We need to see you more frequently to ensure that the disease is not progressing. Again, we'll do everything in our power to ensure that we maximize insurance for you on this, but it really is critical that you are coming in every 3 months to allow us to measure your success and ensure that this level of disease is not getting worse. What questions do you have? And that is exactly how I convert the patient over from a long-term prophy to the periodontal non-surgical scaling and root planing. They need the proof. They also need the confidence. If you waver back and forth, they're going to feel that waver back and forth. When I've practiced 11 years and I am now typically hired into practices to be their periodontal fixer, if you will. And my compliance rate is through the roof because I start with showing them the evidence of disease throughout the appointment, and I make it more into a systemic approach. We're talking about their specific risk factors. I'm not blindly quoting a research. I'm linking it to them. But then I'm also showing them how they have power to prevent it from getting worse. So it creates a more optimistic approach, if you will. And especially when I'm treating patients, that patient has a 5 millimeter pocket, we're recommending non-surgical scaling and root planing. This means we've caught it early. This means typically we can use a topical anesthetic. We don't have to get that patient fully numb. So of course, when we're identifying at its earliest stages as well, it creates better outcomes rather for the patient and also prevents a lot of fear from happening in that patient. Thank you so much for joining me with today's TIPisode. I could go on for hours about this, so if you want to learn more, feel free to reach out to me or join one of my programs. Again, thank you to GC America and A Tale of Two Hygienists for having me. Be well.
Thanks for listening to another TIPisode, and thank you to GC America for sponsoring this week's episode. You can find out more about their great products at gcamerica.com. And don't forget to hit the subscribe button in your podcast app. Follow us on Facebook or Instagram, and head over to our website, ataleoftwohygienists.com, to sign up for our newsletter. And we always appreciate ratings and reviews. Thanks again for listening to your unofficial dental hygiene podcast.